So tell me about some of the little recovery touches that you offer that make a big difference for comfort and for healing.
So a lot of times, compliance with medications as we prescribe them is huge. A lot of patients basically tell me that they don't tolerate narcotics very well, or they get nauseous after every surgery because they were just treating with narcotics. And to me, the most important part of recovery is the right medication management. So we really rely on NSAIDs and Tylenol to provide the mainstay of patients' pain control. And most patients are not aware how effective those are. If you take Tylenol on a regular basis every 6 hours, and if you take something like Celebrex or ibuprofen on a regular basis every 6 hours, those medications work exponentially better than a single dose of those medications would. And in most cases, after a major surgery, once they kick in, after 3 or 4 doses or 5 doses, after they reach a steady state in your bloodstream, they work all the time. Most patients don't have a need for anything stronger, like the narcotic, like the oxycodone, and that's good because the oxycodone is the one that has all the side effects. Patients who rely on the oxycodone for pain control get initial, pain control, but then they get all the side effects that kind of start building up. Within a day or two, they're miserable, they're groggy, they're nauseous, they're vomiting, they're itchy and constipated, and all those
Constipated,
other
right? Yeah.
side effects that narcotics provide. So my goal is to use that as a rescue medication early on, but to rely on the other safer medications to kick in. And after 2 or 3 days, most patients voluntarily do not take any more narcotics because they just don't need them. But explaining that to the patient and having them really understand that is key. And most of them are on my side once they experience that recovery. And recoveries tend to be much, much easier, much more smooth, because you're not adding a whole slew of side effects to your surgery to deal with.
Well,
Um,
I think that methodical approach is so important too, because patients will think, "Oh, I don't need it." And then all of a sudden they do really need it. And
mhm,
if you stay ahead of the pain. And so I think having that, where you're taking the time to explain, why am I saying this? I'm one of those patients. Like I want to know why. If I understand the why, it's easy for me to do it because then I can make that connection. So I like the fact that can help think about their comfort and
mhm.
their healing from a pain management point of view. Is there anything else that you kind of do that helps them, in that post-operative period?
Yeah, I mean, so the thing you mentioned is very important as to why. If patients understand why they're doing something, they are much more likely to do it. And it takes a little bit of extra time to explain that. Instead of a doctor saying, just take this and call me in the morning, I say, I want you to take it because this is how it works. And the patient's like, oh, I see, I understand. Okay, now I'll take it. The compliance goes up dramatically. But it does take a little bit of more effort on my part to take that extra step and explain it. Um, Other things, we talk about garments. I just want to make sure that garments are not too tight. Sometimes pain just comes from garment being too tight. And the other things patients don't really know is that swelling is maximal 48 hours after surgery for most surgeries, especially big body contouring surgeries. So a garment that is fitting perfectly on day 0 and 1 may not be fitting perfectly, maybe too tight on day two,
Mm.
48 hours later when patients is maximally swollen. And that tightness can chafe into the skin, can leave, skin marks or even compress certain areas and can cause a lot of pain. So, and then patients start taking more pain medications and then they get side effects and blah, blah, blah. So just being on that page, understanding, informing them. So that's another tip, definitely, that especially in plastic surgery, where we do use a lot of garments, something to be aware of.
Mhm.
And the third one is just don't do too much too soon. A lot of my patients are, yeah, actually very comfortable after a major surgery because of our approach with medications. And a lot of our patients are very busy in their lives, and it's hard for them to take some time off. And maybe they have 2 or 3 kids, and maybe their husband took the time off to like help them in the early first couple of days, but now they're back to work, and the patient's alone. And maybe it's like week 1, week 2, and now they want to get back into their activities or maybe start cleaning up because nothing's been done for 2 weeks. And we had to warn them that they're still in the fresh post-surgical period, and just because they're feeling awesome doesn't mean that they should be doing everything or lifting the heaviest objects or going shopping and bringing in all their groceries, because these are the things that lead to sudden complications that we're not expecting, like a hematoma or seroma or things like that. But again, just keeping that patient informed. Those would be the big tips to a better recovery: compliance with medications, making sure garments are not too tight early on, and don't do too much too soon.